Welcome, and thank you for being here today. Before your local sales representative shares specific plan benefit information with you, I'm going to walk you through some basic Medicare information and show you how United Healthcare is more than a Medicare Advantage plan. It's a healthy relationship. At United Healthcare, our goal is simple: to help you live a happier, healthier life. Now let's get started. You're eligible for Original Medicare Parts A and B if you're at least 65 years old or you're under 65 and qualify on the basis of a disability or another special situation, and you're a U.S. citizen or legal resident who's lived in the United States for at least 5 consecutive years. There are specific times when you can enroll in a Medicare Advantage or standalone Part D plan. Your initial enrollment period occurs when you turn 65 or otherwise become eligible for Medicare. It begins 3 months before and ends 3 months after the month of your 65th birthday, giving you a 7-month window. If you have employer or plan-sponsored coverage when you first become eligible, you won't need to enroll until you retire or otherwise lose that coverage. Open enrollment occurs October 15th through December 7th. During that time, you can add, drop, or switch your Medicare plan coverage. The Medicare Advantage disenrollment period occurs between January 1st and February 14th. During this time, you may disenroll from a Medicare Advantage plan and return to Original Medicare. You may qualify for a special election period if you retire and lose your employer coverage, move out of the plan's service area, receive assistance from the state, or have been diagnosed with certain qualifying disabilities or chronic health conditions. I know it might seem like there's a lot of details to remember, but don't worry, it's all here in your Clarity Workbook. Now let's review your choices when it comes to choosing Medicare coverage. You can follow along on page 3 in your Clarity Workbook. Step 1 is to enroll in Original Medicare when you become eligible. Original Medicare Parts A and B cover some, but not all of your hospital and medical expenses, and it does not include the cost of your prescription drugs. Step 2 is to look at your needs and determine if you'd like more coverage than Original Medicare. You can add a Medicare supplement plan to Original Medicare to help cover some or all of the costs not covered by Parts A and B. You can also add a Part D plan to get prescription drug coverage, or, if you prefer, you can choose a Medicare Advantage plan, also known as Part C. It's one single plan that combines Parts A and B and may include additional benefits and prescription drug coverage. Medicare Advantage plans can offer you more coverage than Original Medicare and Medicare supplement plans. The payments we receive from Medicare help with the cost of the plan. Additionally, most Medicare Advantage plans have provider networks that provide services at discounted rates. Plus, most Medicare Advantage plans include extra benefits that you don't get from Original Medicare, such as prescription drug coverage, worldwide emergency care, and out-of-pocket spending limits. When compared to individuals who only have Original Medicare, research shows that Medicare Advantage members have more primary care visits, lower hospital admission rates, fewer days spent in the hospital, and fewer hospital readmissions. In fact, 9 out of 10 Medicare Advantage members are satisfied with their plan. Members express high satisfaction with benefits received, out-of-pocket costs, and the quality of care they receive from their Medicare Advantage plan. There are also Medicare Advantage plans for those with special needs, dual eligible plans for those with both Medicare and Medicaid, chronic condition plans for those with ongoing medical conditions like diabetes and cardiovascular disorders, and institutional plans for those living in a nursing home. Your local sales representative can explain these special needs plans in more detail. There are 10 important points you should know about Medicare Advantage plans. Number 1, you must continue to pay your Medicare Part B premium. Medicare then gives your premium to your Medicare Advantage plan to pay for your additional coverage. 2, if you have existing coverage or employer-provided health insurance and you plan to work past 65, check to see how joining a Medicare Advantage plan could affect your coverage. 3, use of network healthcare and pharmacy providers is typically required. Using providers outside of the network may cost you more. However, in an emergency, you can use any provider. Number 4, depending on your financial situation, you may qualify for help paying your plan premiums or Part D medications. This is known as extra help. 5. If you go without Part D coverage for longer than 63 days in a row after your initial enrollment period, an additional amount may be added to your Part D premium. Medicare Advantage plans that include Part D coverage meet Medicare coverage requirements. 6. Medicare supplement plans are health insurance policies and are secondary to Original Medicare. Medicare Advantage plans combine Original Medicare Parts A and B and sometimes Part D into a single plan. Number 7. Medicare Advantage members must present their member ID card, not their Medicare card, when receiving services. 8. Even though Medicare Advantage plans are privately administered, you have the same rights and protections as you would with Original Medicare. 9. Medicare Advantage plans must cover all of the services that Original Medicare covers and may offer additional benefits. It's important to know that hospice care is still covered under Original Medicare. And number 10, unlike Original Medicare, your plan's annual out-of-pocket maximum is your safety net and assures you'll never pay more than a certain out-of-pocket amount in a plan year for covered medical services. Prescription drug coverage is an important factor for many people when choosing a plan. I'll be reviewing this in more detail, and this information's also included in your Clarity Workbook. First, let's take a moment to clarify some terms. Total drug cost is the total amount you and the health plan pay for your medications. True out-of-pocket costs are the amount you pay for your medications, which includes deductibles and copays or coinsurance. These terms will be helpful in understanding the Medicare drug payment stages, which can be found on page 8 in your Clarity Workbook. Some plans have an initial deductible before drug coverage begins. Other plans may have a deductible only for specific drugs or no deductible at all. If your plan has a deductible, you pay the total cost of your drugs until you reach the deductible amount set by your plan. You then move into the initial coverage stage. During the initial coverage stage, you either pay a copay or you pay a percentage of the drug costs known as coinsurance for each prescription. Your plan pays the balance of the costs until what you and the plan have paid reaches $3,750. You then move into the coverage gap stage. In the coverage gap, you pay 35% of the cost of brand name drugs and 44% of the cost of generic drugs until your out-of-pocket costs reach $5,000. Once your total out-of-pocket costs reach $5,000, you move into the catastrophic coverage stage, where you only pay a small copay or coinsurance amount, and the plan pays the balance. You stay in this stage until your policy is renewed on January 1st. Your local sales representative will be able to answer any additional questions you have about drug tiers and how they apply to your specific medications. You can obtain your prescriptions at a network pharmacy simply by presenting your United Healthcare member ID card, or by using the mail order pharmacy service to have your prescriptions delivered right to your mailbox. Each plan has a list of covered drugs called the drug formulary. Before enrolling in a plan, be sure to ask for a copy of the formulary or visit the plan's website to make sure any medications you're currently taking are covered by the plan. Many plans use tiered formularies to group covered drugs according to cost. For example, the Tier 1 group includes preferred generic drugs. Tier 2 includes generic drugs. Tier 3 includes preferred brand name drugs. Tier 4 includes non-preferred drugs. And Tier 5 includes specialty drugs. United Healthcare wants to help you save money on your prescriptions. One way is by offering lower-cost drugs that can treat the same medical condition as your current brand name drugs. You may be asked to try one or more of these lower-cost drugs before the plan will cover the drug you're currently taking. This is called step therapy. If you need a drug that's not currently covered by your plan, you may ask the plan to cover your drug even if it's not on the formulary. This is known as a formulary exception. You may also ask to waive coverage restrictions or limits on your drug. This is called a utilization exception. Some drugs have quantity limits where the plan will cover only a certain amount of a drug for one copay or a certain number of days. These limits may be in place to ensure safe and effective use of the drug. If your doctor prescribes more or thinks the limits are not right for your situation, you and your doctor can ask the plan to cover the additional quantity. To make sure your drug is used correctly for a medical condition covered by Medicare, your doctor may be asked to provide more information before the plan covers it. You may be required to try a different drug before the plan will cover the one your doctor prescribed. This is known as prior authorization. Okay, now that we've covered what you need to know about Medicare Advantage plans in general, let's discuss the advantages of choosing a United Healthcare Medicare Advantage plan. As you research your plan options, you may find that many plans offer similar benefits at similar rates. But one thing that's not the same is the company you keep. As a United Healthcare Medicare member, you get a lot more than a health plan with a low premium. You get a company dedicated to helping you live a healthier life, physically, emotionally, and financially. You'll get access to care, including a local network of doctors, hospitals, and convenient neighborhood pharmacies. Coordination between your health plan, doctor, and pharmacist to help ensure that all of your prescriptions are working well together. House calls for an in-home clinical visit to complement your doctor's care. And around-the-clock phone access to a registered nurse. You'll get more ways that could help you save, such as member pricing on prescription drugs at pharmacy locations in your community. A preferred mail service pharmacy that delivers convenience as well as savings. And thousands of common generic drugs available at a low cost. You'll also have access to customer service that puts you first. Our compassionate customer service advocates are an important part of your personal healthcare team. In addition to providing answers to your questions, they can schedule appointments and connect you to programs designed to make it easier for you to manage your health. We all want to live a healthier, happier life, and Renew by United Healthcare can be your guide. With Renew, you'll have access to inspiring lifestyle tips, learning activities, videos, recipes, interactive health tools, rewards, and more, all designed to help you live your best life at no additional cost to you. Once you become a member, you can go online to your personal, secure member website anytime. You can check your benefit details, review your claims history, track and pay your premium, get forms and plan materials, find local doctors, specialists, and pharmacies with ease, and print health records that you can bring to appointments. Your member website is a powerful tool, and you can access it as soon as your plan is active. Just talk to your local sales representative to learn more. For more than 40 years, the United Healthcare team has been dedicated to helping our Medicare members live happier, healthier lives. We're also committed to making a difference in the neighborhoods and communities where we live and work. Last year, United Healthcare employees made positive contributions in their communities by logging more than 1 million volunteer hours, building playgrounds, planting community gardens, conducting food drives, and more. And we are dedicated to our military members, veterans, and their families. Some of our efforts to help both veterans and their families transition from combat to civilian life include being a leading sponsor of Ride to Recovery, cycling events that help injured veterans recovering from physical and mental wounds. Our relationship with Paralyzed Veterans of America, helping injured veterans meet their new challenge. And because we value the important role families play in the healing process of our service members, we're extremely proud to have funded the Fisher House at Camp Pendleton. Fisher House gives military families a no-cost home away from home while loved ones receive medical treatments. If you have questions about your Medicare plan choices, the Medicare and Social Security Administration offices can also provide more information, as can your local United Healthcare sales representative. Next, your representative will walk you through the Medicare Advantage Enrollment Guide, reviewing the plan's most common benefits, your rights under the plan with information about appeals and grievances, multi-language interpreter services, a list of covered drugs and their tier level, additional information about benefits and plan riders, and how to enroll, with everything you need to enroll in a United Healthcare Medicare Advantage plan. On behalf of United Healthcare, I'd like to thank you for taking the time to join us today to learn more about your Medicare options. We would be honored to have you as a member, and I wish you the best of health and well-being.